Hi, Dr. John Dang here, chiropractor at Columbia Integrated Health Center. I'd like to take a few minutes to go through some of the introduction of the background of the instruments of Granston technique. Granston technique is considered what's known as an instrument-assisted soft tissue mobilization, and Granston technique is one of the many techniques and modalities that we have here at the clinic to assist in patient care and patient rehab. There are many different choices for instrument-assisted soft tissue mobilization. I feel that Granston technique is one of the more superior techniques for various reasons. One of the main reasons is that Granston technique is made up of a high-grade stainless steel. This stainless steel allows the clinician, when we use it, we can run that instrument over top of patient's tissues, and it actually helps pick up imperfections, scar tissue, fibrosis, adhesions, that reverberates through the instruments into the clinician's hand. That helps us in assessing the right condition. Secondly, you can see that Granston technique is 6 stainless steel instruments. Each one of them are very specifically designed, shaped. Many of them have single and double bevels. Some of them have these knobs and edges, all of which help the clinician conform the instrument to a very specific shape on the patient's structure. A good example, Granston technique instrument number 1, affectionately known as the handlebar. This instrument allows the clinician a biomechanical leverage and advantage where we can get over top of a structure if the patient has really large latissimus dorsi or back muscles. Sometimes we can use this to get in and around the curvature of the neck and apply quite a bit of force. We can use this large concave edge, or we can even use the little 2 knobs centered there. Granston technique instrument number 2, that's this one here, affectionately known as the bottle opener, has biconcave edge, and it's got a single and double bevel. One's a little bit more aggressive than the other. I like to use this instrument especially when we get in and around structures such as the elbow. You can see this instrument fits just about perfectly over top of that lateral epicondyle to target some of the extensor muscle groups. Granston instrument number 3, affectionately known as the tongue depressor. This one is very specific. It's got this pinpoint edge that we can use to get in between small structures and exert a lot of force in a small area. Granston instrument number 4, affectionately known as the butter knife. We use this one because it's got a nice convex edge. It is a single bevel, so it's fairly aggressive. So we can use this to get in between structures of the patient's body that are concave in shape. Convex right into concave. There's a nice uniform contact, and it's very effective in breaking down that scar tissue. Granston technique instrument number 5, right here, affectionately known as the boomerang, has a concave edge, single bevel, and this instrument is especially effective in treating areas of the patient's body, for example, the thigh or the quadriceps that's convex in shape. You can use this to cover a large surface area in a short amount of time. Last but not least, GT instrument number 6, affectionately known as the fish hook, for obvious reasons, has this knob. There's a concave treatment edge here, there's another single bevel concave edge here, and this little hook at the very end. This particular instrument is especially useful in targeting small areas such as in between the digits. You can use it to hook up along the pinky or even the thumb to treat carpal tunnel, trigger finger, tendinitises. You can use this into the foot as well. And oftentimes I might even use this for patients with temporomandibular joint symptoms right into the ear, where we can actually get in here and focus along that jaw joint. So there you have it. Those are the 6 instruments of the Granston technique. In another segment, I will demonstrate and talk about the physiological benefits of GT. Hi, Dr. John Dang here. I'm going to demonstrate Granston technique on John. So what we have here is 6 very specialized stainless steel instruments, each one of which are made up of a high-grade stainless steel. They are not sharp, but they have this edge and angle to them that's used effectively for the treatment. You can see there's 6 here, and this one is known as GT1, which I'll utilize and demonstrate on the side of John's neck. So after a thorough assessment, if we have found during that assessment that there are adhesions and scar tissue into the structure of the patient, what we need to do is release those scar tissue and adhesions. If he's got lack of range of motion, if he's got nodules, if he's got tightness. The goal is to be able to release that and restore normal functioning. So with the Granston technique, we have this emollient that we use to help reduce the friction on patients. I'm going to grab GT4, they are all numbered. With the emollients, I would expose the area and gently apply a little bit of the emollient just to spread the lotion in that area that we're about to work on. So the goal here initially is to go from superficial to deep, light to heavy, and general to specific. Because it's a high-grade stainless steel, I can actually pick up imperfections and adhesions through the instruments into my hands. So as I run the instrument, I can pick up those adhesions and imperfections, and if I find that there's one right there, I might focus specifically on it, do a couple passes in both directions. And if I find that the adhesions are quite a bit more than this instrument can effectively target, what I might do is switch to another instrument. This is known as GT1. With this instrument, biomechanically, I can use my body weight to leverage behind the instrument, targeting the structures with this instrument's effective edge. Oftentimes, what may happen is you might get a bit of a erythema or hyperemia response. Sometimes the patients may experience a bit of soreness, but if you're talking about breaking down scar tissue and adhesions and restoring normal functioning, that's to be expected. After a few sessions, I would definitely follow this up with the proper strengthening and stretching exercises, and we'll have John back to his regular activities in no time.